Hello and welcome to HAP Medicare 101. My name is Elizabeth Robinson. I am a licensed and certified Medicare agent. I work directly for HAP. I am a Medicare field agent is my title. I'm here today to present to you information that will go over the basics of Medicare, the different choices of coverage available to go with Medicare, some reasons why choosing a HAP plan would work for you, and talk about the next steps that I can assist you with. To start with, we're going to talk about what I call the alphabet soup of Medicare. In the world of Medicare, if you haven't already noticed, I'm sure that you will very quickly, that there are lots of letters and abbreviations. So I'm going to try to define some of those for you right now. Part A and Part B are what is known as Original Medicare. These are the two pieces that are given to you by the federal government based on your paying Social Security taxes into the system throughout the course of your career. Part A typically does not have a premium. There are some exceptions, but for most people, there's no premium for Part A. Everyone has premium for Part B. The standard premium for Part B is $148.50 for 2021. If, however, your income, whether as an individual or a married couple filing jointly, if your income is above a certain benchmark that Social Security sets, they may charge you a higher premium. If you feel they are doing this in error because you have retired and therefore your income has adjusted down, you can challenge that directly with Social Security. There's a process to go through and they can adjust that for you. They control that information. Part B premium is always paid directly to Social Security. Everyone must pay that, no matter what additional insurance you get. Part A is generally understood to be hospitalization coverage, and Part B is generally understood to be outpatient medical. In fact, when you get your red, white, and blue Medicare card, it'll say on it your name, your Medicare identification number, and then it'll say hospitalization A and a start date, and a medical B and a start date. If you are turning 65 and still working and have access to an employer-based coverage, an employer-based health plan as a benefit from the employer, whether it's your own or from a spouse, that you are covered under, you do not necessarily have to turn on Part A or B at that time that you are turning 65. You can opt out of Part B as long as the employer has more than 20 employees without facing any late enrollment penalties later on down the road when you do retire and want to engage your Part B at that time. That is what Medicare calls creditable coverage, meaning that the coverage that you have from that employer is at least as good as Medicare by Medicare standards. Therefore, you can stay on that plan instead of turning your Medicare on and have that coverage in place until you separate from that plan. That's the time at which you would want to turn on your Part A and Part B if you're over 65 and now retiring. Part A, Part B together, these are the two pieces given to you by the federal government. These are pieces of insurance. Together, they cover about 80% of the cost of your services, leaving you with a responsibility of about 20% with no cap to that dollar amount. That is why most people who are on Medicare choose to elect additional insurance to go with it to help reduce that 20% gap. Like I mentioned also, if you do not turn Part B on when you become eligible for it, unless you have that creditable coverage in place, at a later time when you do turn Part B on, there will be a late enrollment penalty for Part B. That late enrollment penalty is a monthly penalty, and it will follow you for the rest of your life as long as you have Part B coverage in place. So the moral of that story is to make sure that you turn Part B on when you need it, unless you have creditable coverage, again, employer-based coverage, that is considered creditable, and therefore there will be no late enrollment penalty. Working with an agent like myself can help you identify whether or not you need to turn Part B on and when you should do that. If you notice, Part A and Part B cover medical services only. So in order to have prescription coverage, you must select a Part D plan. I always say Part D as in drug. Part D can be a standalone plan, otherwise called a PDP, short for prescription drug plan, or it can be wrapped up and included in a Medicare Advantage plan, which is also called Part C. Part D, just like Part B, if you do not enroll in it when you become eligible, unless you have creditable coverage in place, there will be a late enrollment penalty at a later time. And again, that penalty is a monthly penalty and it will follow you for the rest of your life as long as you have Part D coverage. So once again, the moral of the story is to make sure that you enroll in Part D coverage when you become eligible, unless you have that creditable coverage in place. Now for prescription coverage, Medicare considers employer-based coverage to be creditable, but they also consider VA coverage for prescriptions to be creditable. So as long as you have creditable coverage in place for prescriptions, you cannot enroll in it and not face a late enrollment penalty later on down the line. I deal with more people that have a Part D late enrollment penalty than Part B. What happens often, unfortunately, is that when people are turning 65, they think to themselves, well, I'm pretty healthy and I don't take any prescriptions. Why would I want to pay for Part D insurance? Well, the answer to that question is the late enrollment penalty. If 5 or 10 years down the line, something changes in your health and now you need to take prescriptions, now that you want to engage Part D coverage, that late enrollment penalty can make it more expensive in the long run than if you had paid for it from the beginning. Again, working with an agent can help make sure that you are getting the right coverage at the right time and hopefully reducing that, keeping that monthly premium down to what works best for your needs. Part C, or Medicare Advantage plans, are one of the types of insurance that you can get to go along with Part A and Part B. The other type is called Medicare Supplement Plan, and I'll talk about the comparison between Medicare Advantage and Medicare Supplement in just a few moments on another slide. But what happens with Medicare Advantage plans, or Part C, is that Part A, Part B, and Part D are kind of all wrapped up in one plan. So it kind of becomes one-stop shop. So Part A, Part B, original Medicare. Part C, Part D are insurance that the Medicare beneficiary will select from the carrier of the choice. Now, one other detail about Part D that I want to talk about before moving forward is that there is a set of limitations that Medicare establishes that is subject to everyone who has Part D coverage with two exceptions. This set of limitations is called the coverage gap or the donut hole. I'm going to talk about this in just a couple of moments here to explain how this works to you. The two people who are exempt from this coverage gap or exposure to this donut hole that Medicare sets up for prescription coverage. One of them is if you are eligible for a retirement health insurance benefit from your employer. That is a Medicare Advantage plan that exempts you from this coverage gap. The other person is someone who's eligible for a program through Social Security called Low Income Subsidy. It's also referred to as Extra Help. Again, this is a program directly through Social Security, so it does not have the same requirements that your state Medicaid programs will have. If you are eligible for this program, it will not only waive exposure to this coverage gap or the donut hole, it will also lower any premium that you have for the Part D prescription plan, and it will also lower copays. So it is a great program to be a part of if you are in the lower income, especially if you use prescriptions that are expensive. So let's take a deeper dive into the coverage gap and take a look at what this actually looks like. So this is often referred to as the donut hole, and if anyone mentions the donut hole and has any exposure to it, knows anything about it, usually when you hear the word donut hole, it's associated with a big sigh or groan, because it's usually not a good experience for most people. The best thing that I can do as an agent working with my clients is to make sure that they are aware of and prepared for this coverage gap or the donut hole. Because unless you're one of those two people that are exempt from the coverage gap, everyone else who has Part D coverage is exposed to this set of limitations. So what happens is that Medicare sets up certain benchmarks that throughout the calendar year, as you cross these benchmarks of cost of your prescriptions, it moves you from one stage to the next, in which case it can change how much you pay out of your pocket for prescriptions. The first stage is where coverage begins. Medicare allows the carriers that offer prescription coverage to set up to a $445 deductible in 2021. Deductibles for prescriptions on Medicare plans cannot exceed $445. However, that doesn't mean that they have to have a deductible. There are options where there is no deductible available, so doing some research about the plans that are offered is very important. So the first stage is where coverage begins. Day one of your coverage, any prescriptions you have that you get refills for, you will pay the full cost of that prescription up to that deductible, which again is up to $445. Once you hit that deductible, if there is a deductible, then you will be moved into the initial coverage stage. At this point, you will pay the copays or the coinsurance that are outlined by the plan that you have selected. You will pay these copays until the total cost of drugs, the wholesale cost of drugs, between where your coverage begins and the initial coverage stage reaches $4,130. At that point, when the wholesale cost of your drugs reaches that dollar amount for the calendar year to date from the start date of the plan, that is what pushes you into the actual coverage gap or the donut hole. In this donut hole, this is where you will, as a member, pay 25% of the cost of all of your prescriptions. So in the initial coverage stage, you are paying copays or coinsurance as set out by the plan. Now you are paying a straight 25% of all of your drugs, no matter what tier level, whether they're name brand or generic, you will pay 25% of the cost of those drugs. You will do that until certain costs adds up to $6,550. I will define what those are in just a moment, but once that benchmark is reached of $6,550, now you are in the catastrophic coverage stage where you will pay a very low copay of approximately $4 or $10 or 5% of the cost of your prescriptions, whichever amount is higher, for the rest of the calendar year. Now let's talk about what adds up to that $6,550 to get you out of the donut hole. That would be what you have paid in the first stage where you have that deductible. It will also be anything that you as a member paid out of your pocket for copays or coinsurance in the initial coverage stage. It will then be added to the 25% of the cost of any of your drugs that you're paying for in the coverage gap, as well as an additional 70% of the cost of any name brand drug that you have in the coverage gap. All of those amounts combined add up to $6,550 is what pushes you into the catastrophic stage for the rest of the year. Now, if you take a couple of generic prescriptions, you will likely never enter into the donut hole, so you don't have to worry about it. If you do take prescriptions that are expensive, this is where you want to be aware of and prepared for this set of limitations. In order to assist you with this, the carrier that you select your Part D coverage with will send you a monthly report that will show you exactly what you paid that month out of your pocket for your prescriptions, what the insurance carrier contributed to the cost of your prescriptions that month, the total to date that has been paid that counts toward that either $4,130 or the $6,550, and exactly what stage you are in. That monthly report is imperative for you to be able to track and project if or when you might enter the donut hole or the coverage gap. Also, working with your pharmacist can help you with a lot of information about ways to help cut down costs of expensive drugs if you do enter that coverage gap. This is an incredibly complicated situation, unfortunately, there's no specific dollar amount that any one person should be prepared to have to spend on their prescriptions, because for each person, it depends on the cost of your prescriptions and where you get them filled, what those wholesale costs are, and therefore what will trigger each of these stages. Again, working with an agent can kind of help you identify this and map it out for you. There's also tools on Medicare.gov that will help you enter in the amounts of the prescriptions that you take, the dosages that they are in, the pharmacies that you get them from, and it will help you map it out as well as an estimate only. Again, there are tools out there to help you understand when or if you would hit the donut hole, therefore to help you be prepared for it. Moving on, let's talk about comparing Medicare Supplement and Medicare Advantage plans. Medicare Supplement plans are also referred to as Medigap plans. Again, one of the quirks about Medicare is that you'll find that there are lots of terms that sound completely different that mean the same thing, and lots of terms that sound completely similar that mean completely different things. Medicare Supplement and Medigap is an example. So Medicare Supplement and Medigap are the same type of insurance, a Medicare Supplement plan. These plans are designed by and controlled by Medicare. Therefore, they are standardized and are the same with any company. So a Medicare Supplement Plan F with Company X is exactly the same as a Medicare Supplement Plan F with Company A, B, or C anywhere in the country. Because Medicare is in charge, you are utilizing Medicare's network of providers, so you can go to any provider at any time, never needing a referral or an authorization to see a provider, as long as they participate with Medicare. These plans are also called the Medigap plans because the initial intention of the Medicare supplement plans was to remove that 20% gap in coverage that Part A and Part B alone leave the member with. Nowadays, there are some out-of-pocket requirements. It depends on how much that out-of-pocket requirement is, depending on the plan that is available or chosen. So these plans are Medicare Supplement, Medigap plans. They typically have a higher monthly premium than the counterpart of Medicare Advantage plans, but there are little to no out-of-pocket costs for services, for medical services. Because Medicare is in charge, these plans only cover the services that are covered under original Medicare, meaning your inpatient medical and outpatient medical services. There are no other services included. So prescription coverage, your Part D, must be purchased separately, and there's no coverage for things like vision hardware, dental, or any added value benefits like over-the-counter items or fitness benefits. These things are something that are not included. Because these plans are managed by, or excuse me, they're designed by Medicare, they can be purchased at any time of the year as long as the beneficiary has Part A and B in place. You do not have to have an enrollment period available. You can apply any time of the year. However, only when you are first eligible for Medicare, meaning when you're turning 65 or if you're under 65 and you're approved for disability, or when you are over 65 and coming off of an employer-based plan for the first time. These are the times when you would have the ability to go onto a Medicare supplement plan with no underwriting, so it's guaranteed to be approved for you. Outside of that, there are very few examples of when you would be able to apply for a Medicare supplement plan without medical underwriting. That means that the plan that you're applying for with the company, that company is going to take a look at your health records, any pre-existing conditions, and what prescriptions you take, and see if they can approve you according to their Medicare underwriting guidelines. If you are approved, then you can make that move to any Medicare supplement plan at any time, as long as you have Part A and Part B. If you are not approved, you would not be able to make that move though. So you want to stay where you are with whatever coverage you already have in place. Premiums can vary from plan to plan, from carrier to carrier. They are based on age, gender, and tobacco use. So generally speaking, the premium does increase the older you get. So to kind of review this a little bit, they're controlled by Medicare. They're standardized. They use Medicare's providers. They may be medically underwritten if you are not initially eligible or in your 12-month free look period. And you do have to purchase prescription coverage separately. So it's kind of a la carte. You have your Medicare card billing first, you have your Medicare supplement card billing secondary, then you have your prescription card, and if you purchase something separate for vision and dental, that would be extra also, that would be separate. So it's kind of a la carte at that point. The flip side of the coin is a Medicare Advantage plan, otherwise known as Part C. What happens with a Medicare Advantage plan is that the carriers have a contract with the federal government where we take over administrating your Part A and Part B benefits on their behalf. They hand everything over to us and say you have to cover at least what original Medicare covers, but everything else is up to you. So because of that, they're handing over to the carriers a lump sum per beneficiary to cover the cost of administrating your claims and paying your Part A and Part B claims for them. That money is being used to help lower the monthly premium and out-of-pocket costs for you. There are many options in the market that have a $0 monthly premium, in fact. So your only out-of-pocket cost for premium would be what you have to pay for your Part B. Adding a Part C plan could add a $0 monthly premium, therefore no additional monthly cost for you. However, the plans do have out-of-pocket costs for services, and those services will vary from plan to plan. Those costs for those services will vary from plan to plan, but they're usually pretty reasonable and very comparable to what you might have had on an employer-based plan. Because now the carrier is in charge of the plan, you must choose the network that the carrier offers that works best for your needs. In the world of Medicare, you have the choice of HMO, HMO POS, or PPO. Again, working with an agent can really help you identify which of these three networks would work best for your needs to see the providers that you want access to. It isn't necessarily a limitation as long as you make the right choice. With a Medicare Advantage plan, you can only enroll during certain times of the year when you have Part A, Part B, and an eligible enrollment period. These eligible enrollment periods can be when you are first turning 65, your initial coverage election period. It can be a special election period when you have a life qualifying event that triggers a special period. It can be the annual enrollment period, which comes up every fall between October 15th and December 7th. That is the time period every year that Medicare sets up so that Medicare beneficiaries have the chance to reevaluate what you have and see if there's something better on the market that will work better for your needs and make that change for January the following year. All of the Medicare Advantage plans do include worldwide emergency and urgent care coverage, and they usually include additional benefits. This is where the Medicare Advantage market becomes incredibly competitive, which works in the beneficiary's favor. The harder the carriers have to work to grab their attention based on these added value benefits, the more value that member is going to get out of these plans. The added value benefits will usually include prescription coverage, but also hearing aids, preventive dental, vision hardware, a fitness benefit, as well as an over-the-counter allowance to order over-the-counter items, and other services as well. Again, this is where this becomes an incredibly competitive market. And because everything is kind of wrapped up in one card, this becomes one-stop shop versus the Medicare supplement plan, which is kind of a la carte. So hopefully this helps you understand the difference between the two, but I want to give a couple of examples of who each of the different types of plans might work best for. If somebody says to me, you know what, I'm okay right now, but recently I've had cancer diagnosis that I'm in remission, but when I had the cancer treatments, I know that there were a lot of claims that happened. Or I have X, Y, or Z diagnoses where I know that I need services coming down the pipe that will give me claims that I'll have to pay for. in a circumstance like that where you know that you're going to have a lot of medical claims that you're going to be looking forward to, that this will help, a Medicare supplement plan would help reduce that out-of-pocket cost even though the monthly premium is higher. If someone says to me, you know what, I don't care what my monthly premium is, I don't want to see bills, then a Medicare supplement plan again would work well for that. If somebody says to me, you know what, I travel all over the place and I want access to Medicare providers anywhere I go, I never want to have a referral or pay different costs out of pocket, again, a Medicare supplement plan can work really well for that. If, however, you say, you know what, I really don't need a lot of services. I'm in pretty average health. I mean, unless something drastic changes in my health, I don't really foresee any massive changes. And if I do have massive changes, I still can be prepared for that out-of-pocket maximum. I'm okay with that. A Medicare Advantage plan could work. If you say, you know what, I really like the idea of having a low or no monthly premium, I can handle bills as situations come up, but I don't want to add to my monthly budget. A Medicare Advantage plan works for that. If you say, you know what, I do travel, but I don't plan to schedule services while I'm traveling. I schedule them mostly at home while I'm at home to when I need to have a surgery or a procedure done or physical therapy. So I really don't need access to providers outside of the network area. Again, a Medicare Advantage plan can work. Another person might be someone who says, you know what, I like the idea of not paying a lot out of pocket on the Medicare supplement plans, but I really like all of the added value pieces because I need dental and I need a new pair of glasses, and the gym membership would be fantastic to use. Again, all of those added extras come with a Medicare Advantage plan. So that might be another example of who a Medicare Advantage plan would work for. On the next few slides, I'm going to show you some monetary examples. So here, this gives the same exact situation as far as office visits and specialist visits and days in the hospital and one visit to the ER, and the difference in cost out of pocket because of the difference in cost of premium. So this is just showing you one example based on premium plus the prescription premium and the deductible. And then you add in the cost out of pocket for the services, which is all zero, but your premium is high. On the flip side, with the Medicare Advantage plan, you have a $0 premium for both the medical and the prescription. You only have a small $145 deductible, $0 cost for office visits, maybe $300 for 6 specialist visits, 3 days in the hospital at $690, 1 ER visit at $80. That all adds up to $1,215 versus the $2,136. Again, this is just one example. Let's look at another one. Again, Plan G versus a Medicare Advantage plan with different services. So now this one, because there's a lot more services that are used, and on the Medicare Advantage side, there are 10 visits to the specialist, 2 3-day visits to the hospital, along with the ER. So the out-of-pocket cost for services is a lot higher than it had been on the previous example. So here, the difference in out-of-pocket cost between the premium and cost of services is much closer. So it kind of comes out in the wash. One further example, oops, excuse me, I beg your pardon. Those are the 2 examples that I have. I'm sorry, I thought I had another one. I beg your pardon. Lastly, we're going to talk about the enrollment periods for the Medicare Advantage plans that you might have available. Again, I talked about the initial coverage election period. This is when you first turn 65. You have a period of 3 months prior to the date of your birth, the month of your birth, and 3 months after the birthday month. If you select plans and have your Part A and Part B turned on for the first of the month of the date of your birthday, if you select plans prior to that in the first 3 months, everything will line up for you and start on the first of the month of your birthday. Now, if your birthday is the first of the month, Medicare will actually start the first of the previous month. So if your birthday is July 1st, your Medicare will actually start on June 1st. So if you make your selection between April and May, Everything will line up for you, your Part A, Part B, and your Medicare Advantage plan or your Medicare Supplement plan all begin on June 1st. Now, if you're like me and my birthday is July 7th, my Medicare is going to begin on July 1st. So I have April, May, and June to make a selection for everything to line up on July 1st. But I tend to be a procrastinator. I admit this, it's part of who I am. So I might not have made my decision in the 3 months before, but maybe I make it by July 15th. So I do an enrollment in the month of July. That means that my Part A and Part B started for me on July 1st. I have original Medicare in place. I myself have 20% responsibility for cost of service during that month, but my application on July 15th will make that plan start on August 1st. Special enrollment periods can pop up for different reasons. Two of the most common reasons would be if you are over 65 and coming off of an employer-based plan for the first time. That gives you a 60 days prior to and 60 days after the date of the loss of that coverage. Again, if you make the selection prior to the date of the loss, your Part A, Part B, and the start of your coverage that you select will all line up and begin the first of the month following the date of that loss. Another example could be if you're moving from one area to another and have different plans available to you. That can also trigger a special enrollment period. Again, working with an agent can make sure that you are working within that window of opportunity that that particular special enrollment period will give you and help you understand what you need to do and when. And of course, every year between October 15th and December 7th, that's the annual enrollment period every year where coverage will begin on January 1st. So let's talk really quickly about some reasons why HAP coverage, why HAP is a good plan to select for your Medicare insurance coverage needs. The first of which is we're very proud that in 2021, our HMO plan has earned 4.5 out of 5 stars for the CMS, their evaluation of ratings. We are the only HMO in the state of Michigan that has that 4.5 star rating. It also puts us 9 out of 10 new HAP Medicare members like our HAP plans better than their previous plan. That's according to surveys and evaluations. And I'm sorry, back to the HMO, the HMO 4.5 star rating, that puts us in the top 10 plans in the state of Michigan and in the top 10% of Medicare plans nationwide. We're ranked number 1 on CMS Plan Finder for Southeastern and West Michigan Medicare plans. And we have the best customer service scores for Michigan Medicare plans. This is a very big feather in our cap that we're very proud of and have worked very hard to achieve to make sure that service is something that our members really do receive. We are very invested in our members, as well as helping, providing resources, engagement opportunities for our members. We constantly look at ways to lower costs for out-of-pocket services for our members to help reduce their cost, especially for members with diabetes and other situations that we can participate with programs that help them. There's lots of things that we do to try to assist our members. It's a lot of really great information. At the bottom here are 3 links. One is to an article on US News, one is with PR Newswire, and one is with Yahoo Finance, all talking about HAP's ratings this year. Another feather in our cap this year is if you've ever heard of a Net Promoter Score. This is a score that is based solely on consumer feedback. HAP has received a rating of nearly 60, while any other Medicare insurance plan in the country has received around 30. So we are very, very high scores as far as consumer ratings for our Medicare products. Last, I'd like to share anything that I can do to help you with. I can answer questions about your specific situation, whether it be when or if you need to turn Part A or B on, whether it be what you need to do to turn that on, whether it be what kind of plans you want to look at, or if you have employer-based coverage, or comparing it to what you have. I can help you evaluate the type of plan that best fits your needs, whether that's Medicare Advantage or Medicare Supplement. I can verify prescriptions that you take and providers that you use to make sure that they're in our formulary or our network. I can assist with the entire enrollment process, and I actually started in customer service, so I am happy to be a resource even after you've enrolled. I'm not just going to let you walk away and wish you luck. I'm here to help you with any situations or issues that come up. I definitely want to know if any problems come up to help get them resolved and solved in our system. So my name again is Elizabeth Robinson. That is my phone number and my email address. That is not a typo. They took the last letter off my last name. So 248-443-1131 is my direct phone number, and erobinso@hap.org is my email address. I am happy to assist in any way that I can. Even if you decide that HAP is not the right plan for you, I would be happy to assist. So thank you very much for spending this time with me. I hope that this has provided useful information for you. If there's any other details that I can help you take a look at, if after viewing this video you have more questions or need help understanding more about any of the pieces that I talked about, please feel free to reach out to me and let me know. I'm here to be a resource for you. Thank you very much and have a great day.